all 700 people here, which is incredible, for the nurturing relationships to activate your comprehensive prevention plan. My name is Sarah Lacroix, and I'm co-lead for the Strategies Technical Assistance Program with the Children's Bureau of Southern California, and also to the director for the Los Angeles County Child Abuse Prevention Council. In partnership with the Child Abuse Prevention Center in Sacramento, Strategies continue to support prevention collaboratives, child abuse prevention council, and family resource center networks throughout the state. And we're thrilled to come together with all today to share best practices and collective wisdom for the betterment of the resilient children and families we all serve. And now I'd like to introduce my co-lead for Strategies TA and also fellow MC for the day, Elisa Moore.
Good morning, everybody. We're so happy to see you all here today. It's been such a build-up, and it's going to be a really great day. We have such a great lineup of speakers, workshops, and so we're all very excited to be supporting this convening today. And I work out of the CAPC, the Child Abuse Prevention Center in Sacramento, as Sarah's co-lead on Strategies TA.
Wonderful. Thank you, Lisa. So before we jump into content for today, I really want to take a moment to thank the 30+ members of our 2024 statewide convening planning team who've been coming together since August of 2023 to make these next 2 days of learning possible. This year, we had the most robust, diverse, and cross-sector planning team to date, with representation from parents and youth with lived expertise, tribes, various county and state departments, state associations, CAPCs, community-based organizations. So we sincerely hope supportive of your efforts to create change, and thank you all for being here. Elisa, I will pass to you.
Great, thank you, Sarah. So we wanted to share a little bit about Strategies TA and what we do and who we are. So we have over 20 years of building the family strengthening field in California. We support capacity building for community pathways, including family resource centers, community-based organizations, and their networks, along with prevention collaboratives throughout California. We're a resource for elevating community voice and sustaining collaboration. And lastly, we support Child Abuse Prevention Council leadership and the new statewide CAPC network, which we're very proud of being involved in and facilitating. So just some housekeeping items. This event is being recorded, and a link to the recording will be provided to participants shortly after the second day. And as we said in the chat, the workshops are all recorded too. So we understand you can only make it to 2, and there are probably 20 others that you'd love to be able to see. So you'll be able to do that after the event ends. The slide deck is now available under the Resources tab located on the Zoom toolbar and will be provided in the chat. A full list of today's workshops will be provided in the chat. Workshop presentation materials will be available in each workshop session under the Resources tab. Enter your questions around content using the Q&A feature located on the Zoom toolbar on the bottom of your screen, and then use the main session chat here for comments, reactions, and reflections. Please complete the evaluation survey at the end of the day to help our planning for next year. And I would add, so if you also have technical support questions, please put those in the chat so you can get support and help there. So we wanted to provide an overview of Zoom and kind of give you some explanation about why we're using this particular platform for our event today. So Zoom Events is a tool that's able to accommodate really large groups like we have today. Over 1,000 people have registered for this event. Zoom Events allows for the flexibility to toggle back and forth between the main room and our workshop sessions. It supports both virtual and hybrid meetings, which we're going to be doing today and tomorrow. And it allows us to communicate with you to provide tech support throughout the event, along with the back-end administrative features such as email communications, providing a repository for all our resource links and conference materials, and also registration management, and a whole lot more. But we just felt like it was a perfect tool for what we wanted to be able to do for this convening. So just some brief instructions. You want to keep the browser with the virtual lobby open throughout the event. So you'll have this window where you have workshops, but you'll also have the main room that you stay in and keep open. This is how you'll access the main session and different workshops throughout the day. During transitions to workshop sessions, you'll leave this main session by clicking leave, which is a little unnerving at first, but you won't get kicked out of the entire event. And you'll leave that meeting. You'll return to the browser with the lobby and go to sessions and click on the workshop session that you'd like to join. For tech issues, enter your questions in the lobby chat, and we'll be glad to help. We've got lots of people standing by. And the Zoom events guide is pinned at the top of the lobby chat also. And now Serena is going to give you all a brief tour of the actual main room and give you some hints about how to toggle around between sessions in the main room.
Thank you, Elisa. So I'm just going to briefly go over this. So you're here in the main session. You've made it great. And so I just want to share with you what that looks like in the lobby. You've already clicked on the link to join. You've probably seen this browser on your Google Chrome, your Firefox, your Microsoft Edge. This main page will be the lobby where you'll see different sessions going on. So if for some folks on their main page, on their lobby, they're able to see the sessions and you can access them from there. However, if you are not able to see that on the bottom of the lobby, then you'll go to the top middle section and click on sessions for when we transition to workshops. And then you'll see a full list of the different sessions for today. And to be able to access them, you'll be able to click, when the time comes, there'll be a blue button that says join. So this is how you access all the different sessions. On the right-hand side of the lobby, you'll see a lobby chat. If you have any questions at all relating to tech, please enter it here in the lobby chat, as the main chat session will be, flooded with different introductions, with reactions. So we do recommend that you use the lobby chat specifically if it comes to tech, if you're having any issues, and we'll be able to provide some support that way. All right, I will turn it back over.
All right, wonderful, thank you. So hopefully that helped everyone to get a little orientation to Zoom events. And I also want to let folks know that we do have some emotional support available with 2 different clinicians at various times throughout the 2 days of this event. In really trying our best to remain a trauma-informed event, this year the planning team decided we wanted to offer some emotional support at various times. We recognize that many people here have been impacted by trauma and family violence, and encourage you to call or text the number that you see on your screen to be connected to one of the clinicians should any difficult feelings surface for you at any point in the event. So they are there to support. Please feel free to utilize. It is also a free resource for folks here today. Maybe we can put that number in the chat for folks so they'll have. All right. Next slide. All right, so really quickly, I just want to go through convening objectives for the next 2 days. So supporting comprehensive prevention teams with implementation of their plans through learning from peer partners around best strategies for authentic community engagement and partnership, authentic tribal engagement and partnership, different approaches, developing a community pathway, moving from planning to implementation, and focus on funding and sustainability. Great, so you all see the agenda here today. I won't run through this because I know you have it in a variety of different documents and formats, but we have a great program today. There will be a lunch break, there will be a morning break, and we'll close at about 2 o'clock today. And Elisa, I will pass it to you. Oh.
Great, thank you, Sarah. So we wanted to do a poll, and we'll have Mia put the poll up in the Zoom room and find out who's here. So we're looking at who are you affiliated with that you're here today. We've got Child Abuse Prevention Council folks, we've got Child Welfare Services, we've got Behavioral Health and Mental Health, Probation, State Agency Departments, Education, Tribes or Tribal Affiliation, Community-Based Organizations, Parent and Youth with Lived Experience. And if you feel like you don't fit in any of those, you can click Other and then share out in the chat where you're from.
Lisa, it looks like the poll may have gotten shut down, so we might need to start that over.
Okay. Oh, here we go. Looks like we're making some progress. Can folks see the poll now? It was there.
Let me relaunch the poll.
There we go. So far, 42% child welfare services is the largest group. Got about 22% probation.
Sorry about that. Now the poll has been relaunched. So if you already answered, please answer again. It looks like it just got closed on accident, but it is open again and oh, someone closed it again.
We'll get there.
Okay, we'll try this one more time.
Thank you, Bryn.
So please, my colleagues, if the poll pops up, please don't touch it. I will handle it. There we go.
There we go.
And so, yeah, again, if you did answer one of the two previous ones, go ahead and answer it again. It looks like we have about 70% participation right now. So we'll give it 25 more seconds. Sorry if you hear cats scurrying in the background. It's breakfast time. All right, and we'll give it 5, 4, 3, 2, and 1. And I will close the poll now
Thank you, Bryn.
and share the results.
All right, so it looks like we're about 6.5% CAPSES. We've got about 25% child welfare services, 10% behavioral mental health. We've got 6% probation. We've got 3% from state agencies, 7% from education, and 4% from the tribe. So we're pretty well represented across the board. Interesting. Thank you.
Oh, thanks, everyone. Apologies for the tech issues, but appreciate the patience. So I just wanted to call to your attention some of the work that we'll have here that really have a focus on tribes and lived experts, which are, as you all know, essential voices for real and lasting change within this work. So I just want to acknowledge, as mentioned, this year's planning team included more tribes, lived experts, and diverse partners than ever before. And to those essential team members, I'd like to sincerely thank and acknowledge that it was through your selflessness, passion, connections, and firsthand experiences that we as a larger planning group are able to offer many of the incredible workshops and program you'll all see here over the next 2 days. Your voices provided critical perspectives for planning, greater depth of dialogue, and allowed for this event to reach new audiences as illustrated by the nearly 800 people here today. Your time, energy, and commitment to this work is truly appreciated, and we could not do it without you. Thank you. Additionally, as many of you know, far too many resilient and survival-focused families of color are disproportionately represented in child welfare and probation systems, specifically African-American and tribal families, and this continues to be unacceptable. If we are to truly change our unjust systems to be more equitable, power balanced, and family-centric at every juncture possible, tribes and lived experts must be included in the work. Only those who have gone through it can accurately tell the rest of us how to do it. Taking the time to authentically engage tribes and lived experts with cultural humility and consistent passion is prevention and requires genuine effort on the part of leaders and others in positions of power to prioritize these partnerships while creating space for these voices to truly be heard. As we engage in meaningful dialogue and collaboration during this convening over the next 2 days, I'd like us to commit to acknowledge our current and historical mistakes and any power and privilege we might hold to do this work differently, innovatively, and most importantly, with the voices of those most impacted guiding the way. Thank you all, and in that same spirit, I'd like to introduce Sophia, Jeffe, and Nancy Perez, who are youth convening planning partners. So welcome, Sophia and Nancy. And Sophia, I want over you to take it away.
Hi, everyone. Good morning. I'm so thrilled to be here today as a youth ambassador for the Youth Engagement Project. My name is Sophia, Jeffe, and alongside me is my fellow YEP ambassador, Nancy, and together we serve as advocates for youth engagement within our communities through the Child and Family Policy Institute's Youth Engagement Project. If you're not familiar, YEP is a partnership between CFPIC and the California Department of Social Services to improve child welfare policies, programs, and practices by building capacity for youth engagement at the state and local level. In addition to my work with YEP, I am also the Foster Youth Services Coordinator for UC Santa Barbara and have been an advocate for child welfare reform since my entry into the system in 2014. My lived experience and work at UCSB fostered my interest in educational equity for foster youth and ultimately led me to find the Youth Engagement Project. YEP is more than just a program. It's a movement that empowers young people like myself to make a difference in prevention work. Our mission is to amplify youth voices and perspectives in policymaking across the state, addressing a wide range of issues from education, healthcare, family reunification, kinship care, and even prevention. As young adults with lived experience, we intimately understand the challenges and realities that our younger peers in the foster care system face every day. Through YEP, I've had the privilege of channeling these experiences into meaningful action, from participating in child and family team meeting listening sessions to contributing to planning committees and even testifying at the California Human Services Senate hearing about why kin first culture is so important. Every step of the way has been an opportunity to advocate for change. Youth voice isn't just important, it's essential. Our collective and unique experiences as system-impacted youth bring depth and relevance to CPP implementation. When young people are actively involved in the decision-making process, policies and programs become more effective, inclusive, and ultimately more impactful. Thank you for allowing me to offer a glimpse into the transformative power of youth engagement in prevention work. Having served on this event's planning team, I'm incredibly excited for today's program and all the thoughtful discussions it will inspire. But before we continue, allow me to introduce Nancy Perez, my fellow youth ambassador.
Hi, can you guys hear me okay? Okay. Hi, I am Nancy Perez. I am here with the YEP Youth Ambassadors for San Luis Obispo. I am excited to be here with Sophia, sharing along my experience with you all. I have been an ambassador for 2 years. We have worked on so many projects. One of my favorite projects was making a video of my experience in the foster care system for the 2023 National Foster Care Month, which was shared in the San Luis Obispo Board of Supervisors. I also participated in my county's quarterly quality parenting initiative meeting by lifting up youth voice and discussing about providing trainings and mental health resource for resource families. I was also involved in the planning of Thanksgiving dinner with my youth ambassadors peers, where we put together donations of blankets and essentials received from the county, and we deliver them to the homeless individuals around our local community. Being part of YEP has helped me get out of my comfort zone and be more open with my experience as a youth in the foster care system. I am particularly interested in working with homeless youth and have recently started working with youth advisory board in my county to discuss best ways to serve homeless youth. I have also worked with California Youth Connection, CYC. It's a nonprofit organization that helps improve the foster care system. I am very passionate about using my voice and to improve the foster care system. Thank you for having me be a speaker and be part of the convening team where I am able to share my voice as someone with lived experience. It is my pleasure now to introduce to you Julie Cox from the Child and Family Policy Institute of California, who will be introducing the next speaker. Thank you.
Thank you so much, Nancy and Sophia. We are so proud to have you as part of the CFPIC team, and for all that you do for the Youth Engagement Project. Thank you so much, and thanks for being part of this planning effort and bringing your voice. I'm very pleased now to introduce our next speaker, who will be doing an introduction. Kim Johnson was appointed by Governor Gavin Newsom as the director of the California Department of Social Services in July of 2019. In this role, she leads a team of over 5,000 employees serving over 6 million Californians in the largest department in the California Health and Human Services Agency. Ms. Johnson started with CDSS in 2015 and had previously been appointed by Governor Jerry Brown to serve as the Deputy Director of the Family Engagement and Empowerment Division, CalWORKS and Child Care Branch Chief, and Child Care and Refugee Programs Branch Chief. Ms. Johnson has over 25 years experience working in various family support and children's programs focused on social justice, equity, and poverty disruption in both community-based organizations and government. The mission of the Department of Social Services is aligned with her purpose. She is honored to serve Californians in this leadership capacity. Welcome, Director Johnson.
Thank you so much, Juliet, and thank you to the Youth Ambassadors for kicking us off in a good way. Welcome, everyone, to the 2024 Statewide Collaborative Prevention Convening. It is my honor to welcome you all today. I'd like to first acknowledge that I am speaking from the traditional territory of the Nisenan people, the Maidu people, the Miwok people, and the Winton people. I recognize the continuing connection that Native people have to the land, waters, and culture, and I pay my respect to their elders past, present, and emerging, as well as all of the tribal members who are here today. Throughout the next 2 days, we will be providing many opportunities to learn from each other, to hear about innovative practices, what's working, resolve challenges, how to enhance your teams, and further implementation efforts. I want to also extend my appreciation and gratitude to the entire planning team, but specifically Strategies, CWDA, and the Child and Family Policy Institute for developing an outstanding program. Last year's convening had over 650 attendees, and as you've heard, we have over 1,000 registered participants for this year's convening, which is extraordinary. It's a testament to the continued commitment and dedication all of you have to serve and work towards improving the lives of children, youth, parents, and caregivers across the state. I'm delighted to see such the variety here in representation from youth and parent partners, providers, tribal members, policymakers, advocates, and others gathered here today to learn and share best practices to improve the well-being of our children and families and communities. A special thank you to everyone here who is bringing and sharing their lived experiences and expertise to inform our efforts. And as you heard already, it is my responsibility to use that information in the work that I have and the role that I serve across the state of California. Thank you to the counties who have invited their teams to join them at this convening. We will provide teams in each county and tribe with an opportunity to build mutual connections as a foundation for sustained collaboration. Together, we are working towards developing an integrated statewide system that supports families to provide safe, stable, and nurturing relationships environments for their children. We're committed to creating a kin-first culture by keeping children with their families whenever possible and supporting caregivers. And of course, this is a larger effort. As you know, the governor of California, Governor Newsom, has a family agenda and commitment to addressing inequities resources and opportunities that we've had, such as universal school meal access for children, expanded earned income and other tax credits, expanded access to early learning opportunities, whole family approaches in education, like expanded investments in community schools and so much more. And as I also referenced, the governor's commitment to addressing inequities. The governor signed an executive order naming these inequities, really recognizing that to make up and achieve equity, that's driven by historical, deep-seated structural factors of racism, sexism, and other forms of discrimination. We have to provide equal opportunities for all in California and address persistent disparities in those outcomes. We will know when we are making progress when someone's race, ethnicity, gender identity, sexual orientation, and other forms of social categorization no longer predict a person or community's health and life outcomes. The Department of Social Services oversees and administers programs and services for children, youth, and adults, including prevention programs, foster care, adoptions, economic supports, housing, childcare, and more. The cross-sector collaborative work we do within CDSS and with our colleagues at the Department of Healthcare Services and the Department of Public Health is reflected in the audience here today. As you are conducting your local comprehensive prevention planning, please keep in mind the many additional programs and policies designed to transform systems with upstream approaches that we have created together. Things like our unprecedented increases to CalWORKs grant amounts for our families experiencing poverty in California. Grants have increased by nearly 75% between 2014 to 2023. The full pass-through of child support to formerly assisted CalWORKs families. Program expansions, such as the authorization of cash aid for families whose children have been placed in out-of-home care, but with whom the family is striving to reunify. That simply means that instead of taking resources away from families, we are keeping them and turning them on to increase those opportunities for reunification. The inclusion of voluntary strength-based home visiting in our CalWORKs program, where the outcomes that we are seeing are leading to more children participating in well child visits, developmental screenings, meeting developmental milestones, and greater economic mobility opportunities for families and more. The CDSS is also administering a guaranteed income pilot program and has awarded 7 grantees who are providing unconditional, individual, regular cash payments intended to support the basic needs of those recipients and prioritizing projects that serve aged out foster youth and pregnant individuals. We are also improving access by more than doubling the number of childcare subsidies available to families, with a continued goal to increase by 200,000 expanded childcare subsidies. In the housing space, obviously also near to us as we think about whole family approaches, our CalWORKs Housing Support Program as of last year has served over 65,000 people, and the 30,000 of which are having those permanent supportive housing outcomes post their exit of that initiative. CDSS is also working alongside the Child Welfare Council's Prevention and Early Intervention Committee on implementing recommendations to support implementation of local community pathways for families to access services prior to a call being made to the Child Abuse Hotline, and for families to access services through community-based organizations when direct involvement with the local Title IV-E agency is unnecessary. CDSS is connected to the mandated reporting to community supporting task force and its subcommittees. Let me say that again, mandated reporting to community supporting as our large effort that we shift the paradigm from reporting to providing child and family support to address the concerns professionals would previously have reported to the child welfare system, again, as that's appropriate. California was chosen for Families Are Strong Together Learning Community, also known as FAST-LC. The goals of this one-year initiative are to connect state and tribal TANF and child welfare agencies as a part of a community of peers committed to improve outcomes for children and families and develop innovative policies, programming, and practice models that stabilize families and improve outcomes for children through preventative strategies. We've also refreshed our Linkages 2.0 program, which is a collaboration between CalWORKS and Child Welfare that creates a continuum of services and supports to promote child and family well-being. There's a workshop this afternoon with social services and CFPIC that will have more information and updates, so please listen into that. In collaboration with the Department of Public Health, California's Essentials for Childhood initiative addresses child maltreatment as a public health issue and aims to raise awareness and commitment to promote safe, stable, nurturing relationships and environments, create the context for healthy children and families through social norms change, programs and policies, and uses data to inform actions. The Children's System of Care, also known as AB 2083, ensures that coordinated, timely, and trauma-informed services are provided to children and youth who have experienced severe trauma, and it focuses on creating a system of care to reinvest towards prevention or diversion services. I'm pleased to hear that many Title IV-E agencies incorporated their AB 2083 interagency leadership teams into their prevention teams. These are just a few examples, there are more, that really truly demonstrate California's commitment to the well-being of children, youth, parents, caregivers, and families. I encourage all of us to continue to collaborate, share knowledge, best practices, and champion policies and programs that make a real difference in the lives of children, youth, and communities. We will pave the way together. We want to hear what you all need to get there. The Department of Social Services, along with other state agencies, are here to co-design this transformative shift. You are the agents of change, and by completing your comprehensive prevention plan, you have made the pledge to take action in your communities to lead these efforts to lift up children, youth, parents, caregivers, and families. The Family First Advisory Committee and Community Pathway Committees are kicking off this month, and we are continue with technical support for implementation. I hope that this convening will be an inspiring and informative experience for all of us. Let us take advantage of this opportunity to learn, connect, and collaborate towards creating a brighter future. Thank you for all that you do. And with that, it is my pleasure to introduce Dr. Diana Ramos, a renowned public health leader and California's second Surgeon General and first Latina Surgeon General. As California's doctor, she is the leading spokesperson on the most pressing public health issues of the time within the state of California. Her mission is to advance the health and well-being of all Californians. She has a tremendous background and has been working in California for many, many years, from the Keck University of Southern California School of Medicine to working at the Department of Public Health and more. Over the past 3 decades, Dr. Ramos has provided reproductive care to thousands of Californians as an OBGYN at Southern California Kaiser. Dr. Ramos has written and contributed numerous articles to the obstetrics and gynecology and public health literature and has lectured in Spanish and English, locally, nationally, and internationally. The Orange County Medical Association recently named Dr. Ramos the 2023 Physician of the Year. Dr. Ramos, I'll turn it over to you. Thank you for being here.
Thank you so much, Kim. I really appreciate that wonderful introduction and the honor to be here with all of you this morning. Good morning, buenos dias. Thank you. Thank you for your commitment, time, and expertise to support our children and families in California. Your work is providing families the support that they need to flourish and thrive. And achieving this requires prevention and unwavering dedication and collaboration. I am so thrilled to see that the voices of the youth are here at the table, creating the programs that are needed. It truly is nothing about us without us. You are there helping guide us. Now, as Surgeon General, I understand the importance of prevention in improving health. And implementing prevention is not always easy. I have heard your stories, and I have many of my own to share. As an obstetrician gynecologist, I saw many patients during COVID, and one that stands out was a scenario that played out many times over and over and over again. During the pandemic, there would be a patient that would come in that was pregnant, that wanted to be seen because someone in their household was COVID positive. And they thought they were not feeling well and really wanted to make sure they didn't have COVID as well. Oftentimes, they didn't have COVID and the test was negative. I would give them the usual preventive recommendations: wash your hands, cover your mouth, 6 feet apart, get the immunization. But what ended up happening, the patients would say, "Doctora, that 6 feet apart, it's not always something that I can do." She would turn away and she would start crying, and I could just see the frustration in her face. And she would share, "Doctora, we rent a room in a house where 8 people live. This is a 3-bedroom, 2-bathroom house, and we really can't have that distance. We don't have the ability to do so." So although we knew what the ideal preventive recommendations were, they were not possible for everyone. And this is the critical piece we need to keep in mind, is that just because we know what the guidebook says, just because we know what we would like to do or desire the perfect outcome to be, it's not always possible for everyone. We have to take into consideration in creating preventive plans, we need to understand what is happening not only in the community, in families, and understand the social determinants of health that are impacting the people we care for. Bringing the lived experience from our communities in developing feasible solutions to preventive strategies is critical. When we think about prevention in violence and the trauma arena, prevention is indeed difficult and often thankless work. It's a challenge to emphasize the significance of things that don't happen, the injuries prevented, the abuses averted, but it's precisely this unseen work that defines our mission to not only keep children and families safe, but empower them to thrive. Each of you embodies this commitment. Every day, you lend your time and expertise to support children and families in need. You personify collaboration in action, the team-based approach, the community-based initiatives, the ongoing communication with colleagues across discipline. The work you do with child abuse is not simple or easy, and there is no one single solution. It's a societal disease, multifactorial in nature. And in addressing it, again, that collaborative effort is needed, one that spans sectors and transcends boundaries. Here in California, we are proud to lead the way in this endeavor. The Office of the California Surgeon General has prioritized the identification and mitigation of adverse childhood experiences, or ACEs, and recognizing the profound impact they have on health and well-being. ACEs are common. About 64% of US adults reported they have experienced at least one type of ACE before age 18, and nearly 1 in 6 reported they had experienced 4 or more types of ACEs. Preventing ACEs could potentially reduce many health conditions, such as 1.9 million heart disease cases and 21 million depression cases. All can be potentially avoided. Remember, some people are at greater risk at experiencing 1 or more ACEs than others. While all children are at risk of ACEs, numerous studies have shown inequities in such experiences linked to the historical, social, and economic environments in which some families live. ACEs are highest among females, non-Hispanic American Indian or Alaska Native adults, and adults who are unemployed or unable to work. Recognizing the importance of screening and prevention, California is the first state in the nation to compensate ACEs screening for Medi-Cal patients, a testament to our commitment to promoting healing and resilience. But this is just the beginning. We must continue to champion a whole person, whole family approach, one that fosters dialogue, promotes healing, and identifies strengths and resources. I am deeply inspired by the comprehensive prevention plans developed by communities across our state. The comprehensive prevention planning process is not just a framework. It is a testament to our shared belief in the power of prevention, intervention, and collaboration. Your commitment to proactively address challenges, mitigate risks, and enhance the well-being of families and communities is both commendable and inspiring. By coming together, we affirm our dedication to creating environments that empower individuals. Your dedication and innovation are leading the way forward, and my office, the California Office of Surgeon General, stands ready to amplify your efforts. This forum provides a unique opportunity for knowledge exchange, collaborative brainstorming, and forging partnerships that extend beyond organizational boundaries. There are over 1,000 of you present on this webinar right now. Our diverse backgrounds and expertise converge here, laying the ground for innovative approaches and holistic strategies that will shape the landscape of prevention initiatives for years to come. As we delve into the discussions and workshops ahead, let's embrace the richness of our collective experience and nurture an environment where collaboration flourishes. Together, we have the capacity to not only identify potential risk, but also to develop proactive solutions that pave the way for healthier, safer, and more resilient communities and healthier communities in California. True success lies in our collective achievements, and it is our collaborative work that will truly make a difference. Thank you for the work that you're doing and for the opportunity to welcome you all to your meeting.
All right. So much, Dr. Ramos and Director Kim Johnson. It was great to hear from both of you. I know I feel incredibly inspired and hopeful after what you each shared. And I'm sure everybody else echoes that. And I can tell with all the hand clapping and hearts, that's the case. So thank you for being with us today. We're really, really happy to have you. And I hope we're going to keep the momentum and the inspiration going now as we enter into a dialogue around tribal engagement. It's my pleasure, my sincere pleasure, to introduce Kathy Martinez from the Chief Probation Officers of California. She's been an incredible planning partner for this convening for at least the last 9 months and a lot of behind the scenes as well. So she's been wonderful to work with. She'll be supporting the conversation today with our tribal engagement dialogue. As most of you know, Native American children and families are disproportionately represented in child welfare. And thus it's vital that tribes are an integral part of comprehensive prevention planning and implementation to make real and lasting change. And now I'll turn it over to Kathy and our panelists for a dialogue. Thank you.
Thank you, Alyssa. Good morning, everyone. And thank you so very much to Director Johnson and Dr. Ramos for these important messages about the numerous dimensions of prevention, the importance of collaboration and healing. As Alyssa mentioned, I'm Kathy Martinez. I'm a retired Deputy Chief Probation Officer and a consultant with the Chief Probation Officers of California. And welcome. This morning, we'll hear a dialogue, or more of a conversation really, about tribal engagement to gain a stronger understanding of the true importance of the tribal engagement in our overall prevention work. So just a quick reminder, if you all have any questions, please use the Q&A feature at the bottom of your Zoom bar down there, and we will do our best to get those answered, or hopefully we'll have some time to get to those questions. So this morning we have with us Oriana Walker, Cindy Alexander, and Elise Jones. going to go ahead and start with some introductions, and then we'll move into a dialogue. So please introduce yourself, Oriana, and share a little bit about your work.
Hi, yes, good morning. My name's Oriana Walker. I'm the ICWA Director, Interim Education Director, CCDF Administrator, and also the Interim Social Service Director for the Picayune Rancheria of the Chukchansi Indians. I'm an enrolled member of the Picayune Rancheria of the Chukchansi Indians. And in our culture, when we introduce ourselves, we always give a little background, a little history of where we come from. So I'm the descendant of Luisa Paloma. My parents are Judy and Eucario Alcantar. I have been blessed with 4 beautiful children. I've been working with my tribe in the ICWA department for the last 15 years. All those years I'm completely blessed with. I have collaborated with many counties and many states over the years. I have established many meaningful relationships with social workers throughout the state of California and other states. I'm very thankful for all of those relationships that have been built. I'm part of the Central Valley Partnership Group that meets to discuss important ICWA issues in the Central Valley and plans events. I'm excited to be here today. I'm excited to sit on this panel with these wonderful ladies and to have this conversation and to hopefully give some information or maybe spark some ideas on how we can further collaborate here within the state of California. So thank you, and I look forward to today's discussion.
Thank you so much, Oriana. Cindy, you want to go ahead and go next, please?
Sure. Thank you, first of all, committee, for having me here today. My name is Cindy Alexander. As Oriana shared, our way is to introduce a little bit of our background. So I'm of Kickapoo and Comanche and Yaqui and Chichimex, Mexican people. So I was raised with both Native American and Mexican American culture. I have worked for about 30 years now with the social services in different capacities. I really just want to say currently I work for Central California Training Academy as a consultant as well as a trainer for ICWA for the core practice models. And yeah, thank you for having me.
Thank you, Cindy. And we have Elise Jones, if you can go next, please.
Yeah, absolutely. It's an honor to be here and speak to such a large audience with such incredible co-presenters, co-panelists. And I first want to, so I'm Elise Jones. I'm the director of Lake County Behavioral Health Services. But before I go any further, I want to acknowledge that I'm the descendant of colonizers and I'm currently occupying ancestral Pomo land. I have been working in the field of behavioral health for feels like my entire life, but really started in it around 2004. I've been a court-appointed special advocate for kids, a couple of kids. I've worked in outpatient with both adults with severe mental illness as well as kids. I've done residential with kids, and I'm excited to bring my experiences into a position of leadership and use my privilege to advocate for those that don't have a voice.
Thank you, Elise. And thank you, Oriana and Cindy. So we're going to go ahead and get started in your dialogue. If we can go ahead and start, Elise, with you as to why we have so many county teams, so much leadership in the room today. Can you please share just a little bit about Lake County's journey in engaging tribes?
I can, and I had an opportunity to reflect over the weekend about what that has meant to me. And what surfaced was memories that I had even in elementary school, again, growing up on ancestral Pomo land. And they used to do assemblies where they would dance. And so I had the privilege as a student to watch my classmates, often my classmates, perform their dances for the student body. And in hindsight, that was such an incredible gift. Even to this day, if I'm offered the opportunity to go and be present for a dance, it's hard for me. I even get emotional thinking about it, but I tear up every time because it's so powerful. And so I also had a lot of friends who were tribal or who were Native. And so taking that experience forward into professional experience, I started out just as a regular kind of a social worker going out and working in Lake County. We have a lot of tribal peoples here or First Nations peoples. And so what I learned very early on was the importance of relationship. Nothing important or meaningful happens outside the context of an authentic relationship. And so as a non-Native person who is going in and trying to work with tribal peoples, the thing that I have to do is center their experience throughout the entire process and to be transparent about what I can do and what I can't do. But overall, again, because I am a white woman with a lot of privilege, I need to be cognizant of that as I'm in the room and how I leverage my personal privilege to support those that I'm working with. In an administrative or leadership capacity, continuing to prioritize relationship and authentic and genuine communication, and also acknowledging what has not worked before and acknowledging wrongdoing. So we may not have started the problem. We may not have been the people who originally colonized this land, but it is our responsibility and mine as, again, a white person with a lot of privilege to help lend support to making things right.
And I think exactly what you're saying, Elise, is the main start. Just acknowledging the history in the past sets a good foundation to having those relationships and opening those doors when talking to tribes and talking to leaders, so that the transparency is there, the healing can start, and so that we can move forward together to develop policies, to see what the needs are in the community, and to be able to speak openly about what has happened in our history, how we can move forward, and what our families need. So I appreciate that.
I too appreciate what you're saying, because it's so important for the counties to understand our culture and understand that they first need to do a lot of listening and observing before they're they're expected to receive any kind of trust. And that's so important that they recognize that, it takes time to do this. And if you understand that, then, you're at a good start.
Absolutely. So for us in Lake County Behavioral Health, what that's mean is investing in relationship and taking up opportunities and going. So I think also dominant culture has had this idea of, well, let's invite tribal people or First Nations people to the table. But what table is that? Right? And do you even want to come to this? Who built this table? Right? And so I, of course, continue to invite people to the table, whatever table that is, but I want to go to your table if I'm invited. And I want to sit down and I want to listen to you. And again, do a lot more listening than talking, but acknowledging who built this table is really important in moving that work forward.
And I think that's a very important piece. It's giving the power back to the tribal community. That shows that, the tribe is valued and that we are a sovereign government. Tribes are a sovereign government, and they have the responsibility of preserving the culture, getting the services to the people, and they have the responsibility of governing the community. It's a tribal, I think that often is overlooked, is that tribal sovereignty, that tribal government piece. And that's what needs to be acknowledged. And it has been my experience that we do have some counties that come to our tribe. We have CFTs that are held here at the tribe. And we live in a rural area here in Oakers, which is a part of Madera County. And so we appreciate that. And just to, and we even have lunch together. It really takes the policy out and just really just builds that human connection, that human relationship that is needed. And so, and when they come to the tribe, or people come to the tribe, they get a better understanding of what's happening in the tribe. How is this tribe structured? They get to know our elders in our community and our youth. And we are such a small community that, we talk as a community, we decide as a community. So I appreciate when we are seen and that our sovereignty is acknowledged.
And even breaking it down even further, like Oriana's talking about, is when you get to start to have a relationship with someone in the tribe, don't hesitate to ask to participate in some of their activities that they may have. That in itself shows that you do have a heart, that you do want to participate and build a relationship with them. When I was working with our county, Fresno County, I took some of the workers from from Fresno County out to spiritual gatherings, and so that they could have a opportunity to just, if they wanted to participate in a sweat lodge ceremony, see the dancers dancing and the people gathering together and what that's like, and really get down to the grassroots of the people's culture to understand a little bit better.
Mm-hmm.
I appreciate, go ahead, Oriana.
I was going to say I just want to say, we're talking a lot about tribal governments and, that piece of it. But I think a big piece, and I wanted to make sure to mention this today because I do appreciate the audience and I appreciate everybody here, is that oftentimes I go to stakeholder meetings. Oftentimes I'm looking at data that's being provided from the county, but what's missing is our tribal data. I often don't see Indian Health Service data being shown. I don't see tribal TANF data being shared. I don't see the Native American substance abuse programs, Native American mental health programs data included in the state's data. And that's what data I would like to talk to see. And I want to hopefully, we start looking at the agencies outside of tribes that are servicing Native American communities and not forgetting them as well, because they also need a seat at the table.
Absolutely. That's an equity piece though, right? Again, where is data specific to tribal people represented? So in Lake County, we conduct a point in time count, which is where you go and you literally count all of the unhoused people in your county. And that data then goes to the feds and they determine various housing allocations. And as many people in this room are probably aware, the intersection of behavioral health and housing is growing. So for the first time this year, our PIC count counted people who identified as tribal or who were whatever it was, a tribal affiliation, for the first time ever in 2024. So that should have been happening for a long time. I'm glad we finally did that, but that's important. And I also want to reflect on something Cindy said, and maybe Oriana too, about engaging as a person and really being present as a whole person. And so often what I've seen with tribal engagement, especially for data or for putting pieces of information together or for grants or plans, it may be an outreach to the county or an entity to tribe and be like, hey, would you give us some data? Or could we do a survey? Or could we do this or that? And so being really mindful of what that is, that you're not just checking a box, that says that you engage tribal people to satisfy a requirement at a superficial level, but recognizing that this is a marathon and not a sprint. And if you want to have meaningful change, if you live in that community, you need to ingrain in that community. You need to go, and if you can sit at the table and share a meal together, that would be great. So we've had a great example here with one of our tribes, Big Valley Rancheria, who is one of the tribes that holds the social services department. Now, we also have many landless tribes, like many other places in the United States, right, where they have been colonized and deprived of any land. And so Big Valley, actually, because they have the social services department, they host a monthly women's luncheon and also a dude food luncheon, which I love the name of that. And so for the past several months, we've come to this monthly luncheon where we sit down and we don't talk about work. We talk about, you know, what it is to be a mother or an auntie or a sister or a daughter in the times that we live in. And I have found that that's really meaningful and helps set the foundation for us to meet as people and get some good work done. So there is a lot of value in showing up as a real person and a whole person in these spaces and authentically engaging.
Mm-hmm.
And showing your passion, you know, how important that is to have it for the, you know, first of all, you know, show your heart and show that your willingness, and that goes a long way. That speaks so much just to make that effort, you know, in providing that coming together and that trust that's needed.
Yeah, and with that, allowing the proper amount of time, you know, not having it to be rushed, not giving a policy to the tribe, you know, with a 30-day deadline that you need to sign this or it's not going to happen. To allow the time to build that relationship and not wait till that last minute, but to already have those conversations going is a huge important piece.
If I can jump in, Oriana, that's a great point. And I think it's also important for us to understand just the difference or how tribal governance is and how it's structured and how it intersects or differs from county government. So can you all maybe speak a little bit around that piece for us?
Well, our structure of our tribal government, we have our leadership who are elected leaders, and they oversee the economic portions. They oversee the social service piece of it. But then they also have to answer to our community, to the general membership, and to the tribe. So when we bring forward a program or we're having these meetings with the county, we have to bring that information back. And so we discuss it as a whole. First, it goes to council, and then it goes to, you know, in our culture, we look to our elders for guidance. And so that with all of that all takes time. And some of our elders, you know, we have to talk to and explain things and get them on how the ins and outs of a program. So all of that is just, you know, it doesn't happen overnight because a lot of tribes have that small community. So we have to be able to answer those questions. But also if we're going to provide services or if we're going to get what the need is of our community, then we have to have those conversations as well. So we have to allot time for that. So our structure, our government structure, you know, we have a constitution, and that's because, you know, way back when they told us that we have to have a constitution. A lot of the tribes' constitutions weren't really written by the tribes. And so that's really not our structure of government. But in order to be federally recognized, then we have to have this. We have to have the constitution. So even, you know, we're kind of forced to have like a structure that isn't really ours, and we're just trying to make it the best that we can and still have braid in our cultural piece of it to this structure. So but I just, you know, I can't emphasize enough, it's just I always say, gotta be human. I understand policies are needed and I appreciate them, but a lot of times, sometimes those policies stop the human and what we would in a direction that it should go because of a policy.
I love that so much. And I think, unfortunately, because colonization has affected every layer of society, and you talked about time. And so even the concept of time and how we measure and experience time is culturally dependent. And so Westerners or descendants of colonizers see time much differently than people from other places in the world. But we have this myopia where we think that our way is the only way. And so being humble and recognizing that no, there are other ways is really important. And there's actually, I'm not an anthropologist, but there's a lot of anthropological data about why different places see time differently. And it's important to recognize that and to intentionally center relationship and being a human in every moment. And even when there are places where we work in government and it's black and white and it has to be this way, acknowledging that and saying, I'm so sorry, I don't have control over this. This is what it is, but how do we move through this difficult moment together?
Right.
Thank you all so much for that. Can you all talk a little bit more about why and how NAVIS service providers, leadership, families, that we should all be engaged in the prevention, not just the planning piece, but also the prevention and implementation phase of things?
Well, I'm happy to kick that off. Again, it requires a lot of self-reflection, and it's a continuous journey of unpacking how my mindset is colonized, right? And how this impacts the way I see and engage with the world, and centering that intentionally. And so if you're a person that happens to look like me and you know you have privilege, also acknowledging that you can't be neutral on a moving train, right? And that's not my quote, that's Howard Zinn. And so if you're not part of those solutions and you're not actively resisting the effects of colonization and oppression, then you are part of the problem. And I realize that's a very radical statement, but it is true in my experience. And so it takes place every single day, looking at every piece of my work and how I touch this and making sure that I am centering equity and justice, right? And that I am a tool to center equity and justice for those people that don't have a lot of power. And even let's unpack the fact that I can get away with speaking this way, and I get, oh my gosh, you're so passionate. Wow, where did you get your passion? And yet a person who looks more like Oriana or Cindy, who is more melanated, right? They're like, oh, why are you so aggressive? Right? And so even the framing of that, like just recognizing that you have the power to do a lot more and you can give space to other people to have passion, because I have passion and I don't get viewed as aggressive, whereas other people will.
Mm-hmm. Mm-hmm. Look at all the yeses. I coming up, all of the, gosh, no. It's very powerful words that you're saying, and I appreciate everything, Elisa, you've shared from the moment that we've met. Like, you've just really ignited, and acknowledged and heard. It feels like you've heard, and that's all we could do, right? And that's what we need to move forward. And when looking at partners and why it's important to reach out to tribal partners and other agencies, it's because they're the ones who service our people. They're in our community. Those are the ones who see, just like the Surgeon General, her story. We have those are the ones that can share our stories. And so I think it's really important to have those voices at the table.
Also, I'd like to add that there's also the non-federally recognized tribes. And I always like to be supportive of them, and so that they're not forgotten. And those that are living in the urban areas, you know, I please don't misunderstand me. I totally respect our tribes in our area, and they need that support. But don't forget the unrecognized tribes and their people, and how you can also build relationships with them. You know, they often use their elders to come and support their families that you know, at their meetings. So I just want to lift that up as well, and continue to have that passion. If I may, I'd like to read something that Jaya John, if those of you who know Dr. Jaya John, wrote and sent this to me, and I often like to share it. So I think this is a real opportunity. If I may read this to you, it says, true humility has little to do with learning about other cultures and everything to do with self-reckoning. It is a convicted, tireless, brave examination of the soul, forever asking the question, how are we participating in this long genocide of people and their ways? True humility acknowledges the generational damage of cultural supremacy, the ongoing arrogance of its mentality and approaches. It sheds its control, impulse, and opens organically into relationship. True humility lets its spirit be broken, not in paralyzing guilt, but in a conviction of justice and repair. True humility does not put the subject on a fiscal calendar. It plants the priority firmly in the heart of the mission. Cultural humility, when authentic, is a system people's way of saying, we have done great harm and we shall never go that way again. Ultimately, it is a faith in the devalued peoples, that they are true and full human beings with every sacred right and power to heal themselves, that the system is not to be the great authority, but the willing student and helper, and that the people must be now and forever regarded sacredly. Thank you for allowing me to read that.
Thank you, Cindy, for sharing that. It just really kind of reinforces some of the messages that we've been hearing. It's just of the importance of us really needing to be humble in our engagement practices and to be present. So thank you so much for sharing that. So another question we have is, can you all share maybe some of the things that stand out with the work that's going really well in some of the counties that you know of, and what makes it be so successful?
I could speak on that. Well, now that I have the platform, you know, I want to give a shout out to social worker out of Fresno County, Miss Jones. She is, we talk like probably twice a week about the caseload. She comes to the tribe. We have those open communications, and when we have an area where we're not in agreement with, then we talk through that. And she doesn't have a timeline. She never puts. She always asks, what do you feel? What does the tribe want? How's this going to work for the family? You know, what's your ideas? And so I always really appreciate her for, you know, making those steps. Working with Fresno County and Madera counties to talk about their ICWA policy, their ICWA handbook. Now, we put a lot of time, a group of us put a lot of time into creating that handbook, something so the social workers can have, you know, while they're out in the communities, making contact with our families. So I do appreciate that. And you know, a lot of times at our meetings, we do have representation, and it is acknowledged here of the non-federally recognized tribes too. And so I greatly and deeply appreciate that as well. You know, that our county, that our neighboring counties, Madera, the one I'm in, and then Fresno, a neighboring one, does acknowledge in the spirit of ICWA. There's a lot of things that are coming out from the CPP planning. We met with the different counties. There's Madera County and the tribe is looking at moving forward with implementing Family Spirit, which is a family home visiting program. So that's needed within our community. We've never had that. So you know, that's just one project that we're working on, and appreciative of that. And then, yeah, the new deputy director over in Madera, you know, got her cell phone number easily accessible. Same with down in Fresno, one of the deputy directors, phone number easily accessible. And again, it's just about that, just having that communication. And if there is any issues, just having that area or that opportunity to talk about concerns, so that we could move forward to better help our families.
Thank you. Cindy, do you have anything to offer in terms of this?
Well, I just would like to add to what Oriana's sharing, because I'm in this partnership meetings that she spoke about earlier. And those are so important. And I if all the counties could have that, where they meet together with the tribes, and again, the non-federally recognized tribes, you know, to be there and hear them and work with them the way, you know, Oriana's sharing, you know, actually coming to her, not her having to go to them. Those are really important steps right there that really build relationships and build that trust. So I really respect being able to be a part of these meetings as an elder and just share experience. So, you know, having elders, you know, there at the table in these meetings that have the experience working with the families, you know, being there for the families, being a voice for the families that they know of that have cases, or just, you know, knowing their personalities and explaining, you know, how they view time. You know, they're going to, if they're supposed to be at a meeting, you know, with the county, if an elder asks for a ride, you know, all of a sudden they're not going to turn that down. You know, their elders in their community are important. So, you know, they might be late to the meeting because they're going to take that elder where they need to take them first, you know. So understanding that and taking to heart, you know, the culture and the difference in the time and how time is viewed.
Thank you. And just one last question is, what advice would you all give to someone or to a county or leaders who has a desire but have been struggling to develop these relationships with their own tribal communities? What are some of those words of wisdom that you all can share with them?
Call, reach out, email, schedule a meeting. Just you know, if you don't know who to contact, there's resources online. There's the Federal Register the BIA puts out, and then just going out and talking to people in the community about who's the leaders, who's the tribal leaders, and then don't leave out the non-federally recognized tribes. It's not their choice to be non-federally recognized. That's doesn't mean that they're non-native. They're native people, Indian peoples that just have not been recognized. They're leaving out. Go ahead, Cindy.
There was a meeting that the county, Fresno County, had called together and asked many of the citizens of the tribes in our area. And they asked him to come again to the office, the county office. And there was hardly anyone who showed up. So I gave the advice that why don't you instead have this at this was an urban resource center, and have it there, that the people would feel much more comfortable and likely show up at the this program where it's that they feel at home there rather than, someone else's home, they're at home. So and yes, that's what happened. We had a good show up to that. So just understanding how important it is to bring these people together in their own environment where they feel more comfortable to be able to open up, and you get them in a place where they're not comfortable, and it doesn't feel comfortable, then the likeliness of being able to open them up to conversation could very well be more difficult. So just understanding and recognizing that.
I appreciate and agree with both what Oriana and Cindy said. And from my perspective, again, as belonging to the air quotes here, the dominant culture, right? I see a lot of mistakes happen when people try to engage and they want it to be on their terms. So engagement with any marginalized or oppressed people, for one, the onus of engagement is not on them. It's on you. It's not their responsibility to come and engage and fix this. It's on you as a person with privilege. And for two, having no ego. Don't get your feelings involved in this, because it is true that there might not be good feelings about the county. There is a lot of history there, right? And having space and humility to accept that and to hear that and to just sit with it and bear witness. So those I think are my first two jobs. My job is here to bear witness and to hear that and to acknowledge that. Because until we can get past that, we can't move forward. And it has nothing to do with my ego. It has nothing to do with my feelings, right? That's not the important part. And so I think if you can do that and be a full human being, you're going to be on good footing. And again, don't make promises that you can't keep, right? So do what you say and say what you do. Because we're all aware that there's been a lot of promises that haven't been kept. So don't do that. If you can't, just say you can't, and that's okay. And then of course, endorsing that if you have the opportunities, the privilege of attending any type of gathering, do that and recognize that you're here in this community. I live where I work. This is my community too, right? And so investing in it like you live there, like you're raising children there, like you want to create a healthier space. So it's bigger than just you.
Thank you all so very much for your time. Do you have any other last final words? We have a couple of minutes left. Any other messages you'd like to share, or any stories of resilience or struggle that might come to mind that you want to share?
I just thank everybody for their time, and to keep the words that we said today and the advice that we give, try to apply it. A lot of times our day gets busy, and by 2 o'clock this afternoon, these words will be lost. But try to really feel it, because every single one of us has that decision to make that change. So
Recognize that the people, and I can't speak for every tribe, but in regards to the culture, understanding that their viewpoint often is coming from a spiritual lens, and respect that, and just include that. Ask those kinds of questions, of how how best to work with these families, you know, and look into again, you know, their practices and how they approach things, you know, in a spiritual way is often, you know, first of all, you know, and when you're in meetings, you know, look towards the elder in the room, show that respect, you know, and first ask them, you know, their opinion and how best to answer things. You know, they may be the quiet one in the room, but, you know, be assured they're the ones that are really observing and listening. And so, you know, they are the ones that have the knowledge. And if you build that respect from them, then that's a real door opening right there. So again, I also too, thank you for listening.
Well, thank you all so very much. We appreciate, we just can't express our sincere thanks and just in your honesty and sincerity in this dialogue. So I hope folks just receive some important messages and can really take those to heart and really truly hang on to those when we engage in our prevention work. For now, I'm going to go ahead and pass on over to Elisa again.
All right. Wow. What a heartfelt and beautiful conversation, really powerful. Thank you. Oriana and Cindy, thank you for sharing yourself so vulnerably and so authentically with us today. It was very powerful. I hope you get a chance to look in the chats to see the dozens and dozens, probably hundreds of comments and suggestions and questions that were generated from this conversation. Elise, thank you so much for your passion and everything that you said. There was a lot of positive feedback and a lot for us to think about as white folk and descendants of colonizers in this country. So thank you for being an ally and for speaking out so clearly. And Oriana, I want to assure you that these words will not be lost by this afternoon. You've given us a lot to think about and a lot that will inform our conversations tomorrow, both in our teams and in the larger room. So we're capturing the comments so that we circle back around and don't let these comments and responses and feedback just disappear, that this will be a dialogue that continues. So thank you very, very much. Appreciate you all. And we'll take you to break now and we'll ask you to come back at 10:45 for our next session. Please stretch, drink some water, breathe, do a little self-care. Thank you.
Back, folks. Welcome back, folks. Hopefully you got a chance to stretch your legs, really drink some water, take care of yourself, and also soak in some of the amazing words of our panelists from the last segment. Just a big thank you to all of them, and really appreciate your time and energy and commitment to this work. So thank you, everyone. All right, so we're going to go ahead and now help folks get into their breakouts, and I'm going to give a little, or the workshops, I'm going to give a little overview and flow for the rest of the day today. So also as a reminder, if you do need ASL in one of the sessions, please send a message to Serena Chow in the chat, and we'll do our best to accommodate all requests. If you have any issues accessing a room, please type your questions or comments into the lobby chat. So we're in the main session still here. You'll type those into the lobby chat. Okay, so overview for the rest of the day. In the gray portions you'll see here, participants are going to be off on your own, accessing different workshop sessions, and you'll have lunch in between. So right now from 10:45 to 12, you'll do your AM workshop sessions. I'm going to give you a little info about how to do that. So to go to a workshop, you're going to exit this main session by clicking leave, just like you would a regular Zoom meeting, and then you'll click leave meeting again. So leave and then leave meeting. You'll return to the lobby via that open browser that you have, and you'll go to the top right and click on the sessions tab. And then you'll go through the workshops, look at the one that you want to join, and click join, and you'll be automatically brought into that workshop. So we'll be in workshops till 12, and then from 12 to 12:30, take a lunch. After lunch, please head directly into the afternoon workshop of your choice. So you don't have to come back here to the main session. Stay in your lobby on your open browser and go to sessions and select the workshop that is most of interest to you and click join on that. So after the afternoon workshops, everyone will return back to this main session at 1:50 p.m. You do have to click main session to get back in here, just a reminder. So for closing, we'll have our closing here in the main session. Keep your browser with the lobby open. Make sure you can access different sessions. If you accidentally have exited the browser with the lobby, no problem. Just rejoin by clicking on the link, the ticket that you got via email or your calendar. And all the workshop sessions will be recorded, so everyone will have access to those if there was more than one you wanted to go to. And for any tech support, again, please type into the lobby chat, and our wonderful tech team behind the scenes will be able to best support you. All right, so go off now. You can, like I said, hit leave and then leave meeting again and get to the lobby on your open browser. And please. All right, so I believe, I don't know if Elisa is back just yet, but I can go ahead and do this one. So a little overview of day 2. So March 5th, tomorrow will be 9 to 4 p.m. And you'll see, I won't read through this all, but you'll see that for most teams, for most county teams, they are going to be in person at a location of their choosing. So we'll be patching into the content. We'll be patching in with you all virtually, and the majority of you I know will be in your actually county sites. So you'll see that there are 3 opportunities to go ahead and meet with your teams in person for tomorrow. And we're going to have a really great day as well. So if we can go to the next slide. Thank you. Okay, so as we get ready to wrap up this incredible day, I want to make sure everyone knows about the upcoming statewide events happening, all related to our prevention work. So as you'll see, the Northern Training Academy, the Academy for Professional Excellence in Child Welfare Development, the California Training Institute, and the Office of Child Abuse Prevention have a lot happening for the next 2 months. So we're going to provide a few links in the chat around these events and definitely encourage you to attend. Additionally, all the links are going to be available. They're all linked in the slide deck as well, which you received this morning. And just to call also to your attention that April, as many of you know, is Child Abuse Awareness and Prevention Month. And so CDSS, OCAP, and the Child Abuse Prevention Center has a webinar series happening each week. So those are really great, and I definitely encourage you to attend as well. All right, next slide. All right, well, we are close to finishing up, and just can't thank you all enough for being here today. Your time and energy is greatly appreciated. As mentioned, if you are able to fill out this survey, we're going to drop a link in the chat, and also you can scan the QR code here as well. We'd love your feedback. It helps us to plan even better for next year. So please take a moment to do that. And I would really, really appreciate your time. All right, let's go to, I believe, our last slide. Okay, if you need any more information or need support, these are 2 great resources. The California Department of Social Services has an FFPSA box, and you'll see the email listed there. They also have a website that you can look at, and there's lots of great information there. Of course, Strategies TA is also a resource to you, and you'll see our website there and also our general info, email, and some of the other ways to connect. I see folks are asking for the QR code again, so if we can go back one. Yes, there we go. All right, so we would love any reflections, comments. Please feel free to put them in the chat. And most importantly, please take a few minutes to fill out the survey so we can make sure that we can plan better for next year. From our team, anything else to add?
I know we had a lot of questions about how to access the resources from the workshop sessions as well as the main presentation. So we will get that available to all folks, and you will be able to access the workshop recordings. They are available now live on the Zoom events lobby page, the session page, I'm sorry. So you'll go back onto the sessions page and you'll be able to watch recording for each of them. So again, the workshop materials, presentation materials, handouts, we'll be able to send that out to you folks, and the recordings are already available.
Wonderful, Serena, thank you. And just a big shout out to our back-end tech team, who you all, didn't get to see necessarily by face, but they've been working really, really hard today and throughout this entire time to prep this event, to make this event happen today. So thank you so much to our tech team. You are much appreciated. I see lots of hearts and claps coming through in the chat. You guys did great. Zoom Events was a new platform for us, so took a little bit of learning, but you all knocked it out of the park. Thank you so much.
Thank you, everyone. And I did place that evaluation link in the lobby chat as well, in case you've lost it in the scroll like I have. So you can also access that in the lobby chat, which is a little less busy.
Thank you, Bryn. Wonderful.
And also just to let folks know, for tomorrow, we will, for those that will be joining us virtually, as well as the site leads and facilitators, we will be opening up the Zoom room at 8:45 again, just to troubleshoot for any tech challenges. So again, we'll have the same platform, as well as if you have any questions or tech issues, please place into the lobby chat tomorrow morning.
Yes, please be safe today. Get to your sites tomorrow safely. Really hoping you and your teams can have a wonderful connecting day.